Multiple sclerosis, it's a pretty complicated disease, right? It affects the central nervous system. So what are some of the key symptoms we're looking at?
Yeah, numbness, tingling, vision problems, and muscle weakness are pretty common.
Okay. And how prevalent is it, roughly?
About 0.5% of the population, I think. And women are 2 to 3 times more likely to get it than men.
Interesting. What age group are we usually talking about here?
It usually starts between 20 and 40.
So let's talk about the myelin damage in MS. Can you explain that?
Sure. The immune system, for some reason, attacks the myelin sheath, that's the protective coating around nerve fibers, and that damage slows down or even blocks nerve signals.
Right. And what are the long-term effects of that kind of damage?
Well, you can end up with permanent nerve fiber damage that leads to progressive disability.
How many different types of MS are there?
There are four main types: relapsing-remitting, secondary progressive, primary progressive, and clinically isolated syndrome. It's a bit complicated.
Okay, so what's the deal with relapsing-remitting MS?
That one has relapses, with periods where you get some or all of your function back.
I see. And secondary progressive MS?
That develops from relapsing-remitting MS, and with that one, symptoms just steadily get worse.
Got it. And then primary progressive MS?
That one starts gradually and just keeps getting worse, without those relapse periods.
Okay, so what are some of the risk factors for developing MS?
Well, there's a genetic component, definitely, and then there are environmental factors. Infections like Epstein-Barr virus, low vitamin D, obesity, and smoking all seem to increase the risk.
How big a role does genetics play?
Having a parent or sibling with MS doubles your risk, yeah.
Wow. And what about where you live? Does that matter?
Yeah, it seems to be more common in temperate climates.
So how do doctors actually diagnose MS?
There isn't one single test, unfortunately. It's based on the symptoms, a neurological exam, brain and spinal cord MRI scans, and spinal fluid analysis.
What kind of things do they see on the MRI?
They look for lesions or areas of damage in the brain and spinal cord.
And how reliable is the MRI as a diagnostic tool?
It's helpful, but it's important to remember that many older adults have abnormal brain MRIs, even if they don't have MS.
Okay, so what are the treatment options for MS?
Treatments focus on managing symptoms and slowing down the disease progression. Corticosteroids are often used for relapses, and then there are disease-modifying therapies to prevent new attacks and lesions.
How many of those disease-modifying therapies are there?
Over 20 medications are approved now. It's quite a lot.
Wow. Are there any other treatments besides those?
Plasmapheresis is an option for people who don't respond well to steroids.
So how are the symptoms of MS managed?
Physical therapy, occupational therapy, and mental health support are all really important.
Right. And what about lifestyle changes?
Regular exercise is a good idea. Managing stress and keeping up social connections are also important.
Okay. And what's the story with vitamin D?
Low vitamin D levels seem to be linked to a higher risk and more severe MS.
What's the current state of MS research?
Scientists are working hard to figure out the causes and develop better treatments.
What are some of the most promising areas of research right now?
Immunomodulatory therapies and treatments that target specific disease mechanisms are showing some real promise.
What are some potential complications that can arise from MS?
Mood changes, muscle stiffness, seizures, severe weakness, and bladder or bowel problems are all possibilities.
And how common are these complications?
That really varies from person to person, and it depends on how the disease progresses.
Where can healthcare providers find more information about MS?
Reputable medical journals and the websites of major medical organizations are good places to start.
Well, thank you so much for this really informative discussion. This has been incredibly helpful.
You're welcome. I'm glad I could help.
That was a great discussion. Thanks again.